Today I'm going to demonstrate how to perform a PA projection of the skull and a PA axial projection of the skull. First thing, before the patient comes into the room, you'll want to make sure that it's set up. I have my tube set at 40-inch SID, and I have a 10 by 12 lengthwise cassette in the bucky. I also have this collimated to 10 by 12. I have this in detent and a 90-degree angle. I have a shield here to protect the patient and a marker on my board, so I'm ready to go. Once you have your patient in the room and everything's set up, you'll have him come over to the wall bucky, and you can either perform this upright or seated, and today I'm going to perform this seated. So I'm going to ask Todd to place his forehead and liaison against the crosshairs, and the forehead should be on the bucky as well. And you'll want to make sure that the central ray is going to exit the liaison, which is right here on the patient. We have the shield, we have our marker here, and it looks like everything is lined up. And if I can have you hold your breath and don't move, and I'm going to take the picture. Great. And the next projection I'm going to show you is the PA axial projection of the skull. And you're going to want to make sure that there is a 15-degree angle on it, angled cod ad. And one more thing I forgot to mention in the last video, you're going to want to make sure that the OML is going to be perpendicular to the IR, to the bucky. And the OML is right here. It's from the EAM exiting the orbital. And again, for this one, the central ray is going to be exiting the liaison. And again, if I can have you hold and suspend your respiration. Okay, and you can relax, we're done.
Today we're going to be going over a lateral projection of the skull. Now we come in and have our room set up for our patient with the tube at a 40-inch SID, and we're going to be using a 10 by 12 IR crosswise, culminated to 10 by 12. Now we have my lovely assistant Angela here. We're going to put her in an anterior oblique position. So we're just going to rotate the shoulders slightly in order to reduce the OID. And we're going to have her place her head up against the bucky. And we're going to have her rotate so she's in a true lateral position. So just kind of look at me. All right. And I'm going to have you move forward a little bit to center you. Move towards me. All right. So now we have our culmination set to 10 by 12, open field. And we're going to have our CR enter 2 inches superior to the EAM. Right in here and right through the mid-sagittal plane. Have you move back a little bit. All right. Now try and turn your head towards the tube. Right there. And now we're going to have her suspend her breathing. So go ahead and take a breath in, out, hold for me, and we'll take our image here. Now relax.
Alright, so today we're going to be demonstrating the Schuler method of the skull. You're going to want a 40-inch SID, a 10 by 12 cassette lengthwise in the bucky, your right marker on the bucky, and it's collimated to 10 by 12 for the lengthwise. The position does call for supine, upright, but since Kate's a little taller, I have her seated in the upright position. As far as positioning goes, we're going to have her seated, make sure that we use the shield. I would have her remove any necklaces, earrings, piercings, any of that nature to make sure nothing's obstructed in the image. And so as far as the positioning goes, you're going to have the patient extend their neck as far as possible to line up the IMOL line, which is the ear hole to the bottom of the orbital bone. Once that is perpendicular, as far as the position goes, the central ray is MSP, and then you'll be making sure that the crosshairs are 3/4 of an inch anterior to the EAM. And then you'll just make sure to have your correct marker. Collimation is open. And then for respiration, you're going to have your patient suspend on expiration.
Okay, so I'm going to show you guys how to do the Town method or the AP axial projection of the skull. You're going to want your IR 10 by 12 lengthwise in the cassette. I have my marker right next to her head. We're going to have the patient tilt their chin in so that we can get the OML perpendicular to the IR. Our centering is going to be MSP. We're going to have a 30-degree angle on the tube head, and it's going to go through the line. The OML is perpendicular to the IR. If the patient is unable to tuck their chin anymore, we can throw another 7 degrees onto the tube, which will adjust for their immobilization.